Hi, it's Dr. Silva, and I'm going to talk to you about 4 reasons why you might want to take Prozac. If you need an SSRI, if your doctor has determined that you need a selective serotonin reuptake inhibitor to block the reuptake of serotonin at the synapse between neurons to increase the concentration of serotonin, if you need to take an SSRI, the difference between the various choices that you have is going to boil down to tolerability. They really differ significantly, not in terms of efficacy across the board, but in terms of what side effects that they tend to induce. And they share a lot of side effects because they all increase the concentration of serotonin by blocking its reuptake. And so you have a lot of overlap, but they're not all created equal. Some SSRIs tend to have certain side effects way more than others. Zoloft and Luvox cause a lot more diarrhea. Paxil never causes diarrhea. Almost never. And etc. So they do differ in certain key points. And so what I'm going to talk about today is how Prozac stands apart from the others and considerations why you might want to choose Prozac or why you might not want to choose Prozac. I did another video on fluoxetine as well as the SSRIs as a class, and you're welcome to check those out. Here are the highlights. 4 things about Prozac that set it apart from the rest of the SSRIs. By the way, Prozac was the prototype. It was the first selective serotonin reuptake inhibitor that was developed following the first generation antidepressants, the tricyclic agents, which are SNRIs. They block the reuptake of both serotonin and norepinephrine. And later we had Effexor and Cymbalta, venlafaxine and duloxetine respectively, that are also SNRIs, but they're modern SNRIs that differ from the TCAs in that they have a lot less side effects and they're safer to use. So between the TCAs and the newer SNRIs and the multimodal antidepressants, we had the SSRI era. It started with Prozac, fluoxetine. Reason number 1, Prozac has no weight gain. And I'm going to say it has no weight gain. There are SSRIs that are notorious for causing weight gain. I'm looking at you, Paxil, and also Lexapro and Celexa, and to a lesser extent, Zoloft and Luvox. But you never see it with Prozac. You just never see it with Prozac. And I'm sure it's been reported anecdotally, but it's actually a medication that's been looked at in eating disorders with not the best results, but it is something that's been studied in bulimia as well as anorexia nervosa. And I just do not worry about weight gain. If I have a patient who needs an SSRI who absolutely cannot withstand weight gain, we can't even risk it, it's an absolute deal breaker, then I think about Prozac. Reason number 2, no physical withdrawal. Physical withdrawal is impossible with Prozac. Now, there's a difference between symptom rebound if you abruptly stop an SSRI and the discontinuation syndrome that is a physical withdrawal. The symptom rebound can happen if you're taking a significant dosage and you abruptly stop it instead of tapering it down, and so maybe you have a few days of irritability. It's usually that. Negativity, maybe. For those patients that have endogenous illness, underlying major depression or generalized anxiety disorder or panic disorder, then they can not only get sort of a rebound that anybody would get, irritability, they actually get a resurgence of the syndrome that we're treating. So it's basically a relapse of the underlying condition. And so they get depressed again, or they start worrying again, or they start obsessing, or their OCD gets really bad, or they start having panic attacks. And that's their underlying illness that's coming up because they should have continued taking the medication and or we discontinued it too abruptly. But there's a third thing that can happen, which is a physical withdrawal, and it's not composed of a lot of psychological symptoms and psychiatric symptoms. It's dizziness and nausea and GI cramping and brain zaps, paresthesias and dysesthesias. And so it's physical things because the medication is leaving your system and there is a physical discontinuation syndrome associated with it. It's really bad with Paxil. Paxil is the worst. It's really bad with Effexor. I mean, there's certain medications that for whatever reason, due to the molecular structure, the body just doesn't tolerate it very well when you abruptly stop it. You should never abruptly stop any psychotropic agent. You should always taper down if you're on a significant dose, if you're on a more than a starting dose. But you don't ever see it with Prozac, because Prozac has an active metabolite, fluoxetine, that has a half-life of up to a week, 5 to 7 days. And real quick, a half-life is the amount of time that it takes the body to clear 50% of a medication. So if you give 20 milligrams of Prozac, you achieve a certain blood level, depending on whether it's a single dose or whether you're at steady state already because you've been giving it for a time. And the half-life is the time that it takes the body to clear 50% of that amount, whatever that amount is. And it takes 5 half-lives to get to 98%, 5 half-lives to completely clear a medication, assuming that you're at steady state. So that's just sort of in a nutshell. The point here is to let you know that the longer the half-life, the longer it takes to completely clear a medication from your system. The shorter the half-life, then the more quickly your body clears it. And if the half-life is very short, then you might have to dose it multiple times a day in order to maintain steady blood levels, because you can't take it once a day because the half-life is so short. The efficacy wanes in less than 24 hours. Well, with Prozac, it has an active metabolite. The half-life of Prozac is significant, but the half-life of its active metabolite, fluoxetine, is a week. That means it takes up to a month to clear the medication from your system. Now, depending on how long you've been taking it, with the dosages, you might start to feel that you're not on it anymore in a lot less than a month. You might start to feel that, let's say, in 2 weeks. But you're not going to feel it from one day to the next. And Prozac is actually a good medication to give to people that are forgetful, that don't remember to take their medications every single day. And those people that you just can't risk them not doing well because they're not taking their medication every single day. And so Prozac is helpful because of this issue. The other issue is that you never ever withdraw abruptly either the psychotropic effects or these physical effects that you can get, because it self-tapers. It effectively self-tapers. You never have an abrupt withdrawal like you do with some of the others. And so you have medications like Zoloft and Luvox that are not notorious for causing physical withdrawal, but it is possible. And I used to not believe that it was because it's so uncommon, but you can in fact experience it with those. And so you have a spectrum, and Prozac is the only one that I can say you're guaranteed not to have it. Reason number 3, there's no teratogenicity with Prozac. The SSRIs can be taken during pregnancy. You really don't worry about fetal malformation, that is, birth defects that would occur if the medication causes a problem in the first trimester when the organs are forming. But in babies that are born to moms that are taking significant doses of SSRIs in the 3rd trimester, you can get certain syndromes. The incidence of neonatal pulmonary hypertension is higher. There's something called a floppy baby syndrome that you can sometimes see with increased incidence on the SSRIs. There can be irritability, increased tearfulness, trouble with feeding in the neonate that may be due to withdrawing from these medications that cross the placenta. But they're not considered teratogenic with the exception of Paxil. Paxil was a pregnancy category D in the past when they had the alphabetized system, and that means that it's known to increase the incidence of cardiac septal defects, atrial and ventricular septal defects, so actual structural abnormality of the heart. The absolute risk is very low, but it's higher than it would be if you weren't taking the medication. And Prozac, like most of the other SSRIs, does not cause birth defects, but it has the most evidence. Because it was the first SSRI that was released in 1987, more people took it and more pregnant women took it, and so you just had more data. And so obstetricians feel very comfortable with it. It's a medication that you can use very safely and with a lot of confidence in pregnant women. Again, probably most of the other SSRIs as well, but definitely Prozac. It's got a good track history. And number 4, the thing that sets Prozac apart from the other SSRIs, this is in terms of a side effect. Again, side effects overlap because of increased serotonin, and it has most of the same side effects as other medications. But one thing that it does probably more than the others, Prozac is more activating than the other SSRIs. And by that, I'm referring to a specific side effect called akathisia. It may not always cause it, but akathisia is a motor restlessness. It's a fidgetiness that occurs because you're antagonizing the actions of dopamine in the brain. So serotonin and dopamine oppose each other. When you increase serotonin, you antagonize dopamine. The levels actually go down, but you also, a lot of the effects, physiologic effects, are opposite of one another. There's a separate video that I do on that as well that you might want to check out. But you can get something called akathisia when you don't have enough dopamine in a certain area of the brain. And what that feels like is just the need to move, and you feel fidgety, and maybe you're bouncing your knee, or you're tapping your toes, or you're squirming in your seat. When it's really bad, you're pacing. You just feel like you're going to crawl out of your skin if you don't move. You're getting signals sent to the brain that you should be moving, and not moving is a huge I don't even know what word to put to it. It's just a feeling of malaise, a dysphoria, and it can be so bad that you just have to stand up and pace around and don't let anybody stop you. It can be very, very severe. But as a side effect, it tends to be more mild, but it still manifests in terms of squirming and fidgeting. Restless legs is akin to it, but this is not just in bed when you're trying to sleep. This is restless body, basically. It can involve the torso and the upper extremities as well, but especially the lower extremities. And Prozac does that more than Zoloft, more than Paxil and the others. It tends to be more activating. And so you have to keep that in mind if you have somebody who's already kind of fidgety or hyperactive that really can't tolerate making that worse. Prozac might not be your best choice. For whatever reason, the increase in serotonin that's due to Prozac induces more akathisia than the other medications. And it's dose dependent, so it matters how much Prozac you're given. And then, of course, the individual. So each individual is going to have their own inherent vulnerability to akathisia. So some people may be fairly immune to it because of their genetics, because of their structure of their brain, and then other people may be more prone to it. But in those individuals, Prozac may cause a little bit more of a problem. So those are 4 things about Prozac that are unique, that make it stand out from the other SSRIs. Please check out my other longer form videos if you are curious to get more information. Thanks for watching.